Here's something I want to help you understand. What you do between your adjustments matters almost as much as the adjustments themselves. So, if you think about it this way, if you were having a cavity filled or having recurrent cavities, your dentist would expect you to brush and floss at home to maintain the work that's happening between appointments. Your chiropractic care is working the exact same way. We are doing the corrective work in the office, but what your daily habits are either support or undermine that work. We're going to talk about the most important ones. So, the first one, number one, is how you sleep. Your sleep position has a direct impact on your spinal alignment for the 6 to 8 hours every night that we sleep. For most people, the ideal position is on your back or on your side, so not on your stomach. Sleeping on your stomach forces your neck into rotation, and that sustained rotation, which puts chronic stress on your joints in your neck and can actually undo the corrections that we're working on. If you've been a stomach sleeper your whole life, I understand, I get it. Changing it's going to be hard. So start with trying to sleep on your side. Use a pillow between your knees to keep your hips level. Sometimes you see a longer pillow, like a pregnancy pillow or even a king size pillow. You can keep it between your knees and then hug it, which will prevent you from rolling back onto your stomach. Over time, your body can adapt. Pillow height matters too. Your pillow should keep your neck in a neutral position when you're sleeping, so not pushed up or not bring your head back down. We can give you specific recommendations and have a pillow that we love that's based on your body size. So if you're interested, please make sure you ask us about it on your next visit. Number two, how you sit. We are in the middle of a sitting epidemic. Most people spend 8, 10, sometimes even 12 hours a day seated, usually in positions that progressively load the lumbar spine and push the head forward. Think about a fresh green branch from a tree. It has moisture inside of it. That's what makes it flexible and resilient. Your discs are the same way. They're largely made of water, and that hydration is what gives them their ability to absorb shock and bounce back after being loaded. Now take that green branch and bend it slowly in one direction and hold it there. Hour after hour, day after day, it doesn't snap, but it stops springing back. A permanent crease forms where the load was concentrated. That's exactly what happens with prolonged sitting, what it does to your discs. The sustained forward flexion causes pressure at the front of the disc, over time causing the outer fibers to get weaker and deform right at that stress point. So eventually the gel-like center called the nucleus, it starts to push towards that weakened area. That's a bulging disc. Push it far enough, and that outer wall gives way, and eventually that's entirely what we call a disc herniation. On the other hand, a dry, brittle branch is what happens after years of that neglect. The disc loses its water content, its height, and its ability to absorb load. And just like that dry branch, it doesn't crease first to warn you, it just gives out, often doing something completely ordinary like bending down to tie your shoes. So what can you do? Set a timer on your phone or computer to stand up and move every 30 to 45 minutes. Even 90 seconds of movement makes a significant difference over the course of a day. So just even standing at your desk and doing some gentle stretches if you can't take a longer break. When you do sit, try to sit with your ears over your shoulders over your hips. Your screen should be at the top of it should be at eye level. We have a neat infographic that outlines this. Just ask us and we will send it to you. Using your phone. So you've probably heard the term text neck. It's real. When your head drops forward to look at your phone, the effective weight on your cervical spine or on your neck increases from the 10 to 12 pounds to 40, 50, even 60 pounds, depending on that angle. So what you can do is bring it up to eye level. It feels strange at first, but do it anyway, and your neck will thank you. Number 3, hydration. Your body is 60 to 70% water. If you don't get enough water, your body will literally leach it from your muscles to get it to your vital organs. This can cause muscle soreness and dehydration as well. Your intervertebral discs are largely made up of water as well. So this is that gel-like substance that's between the spinal bones. This also depends on good hydration to maintain height and shock absorbing functions. Dehydration doesn't just give you a headache, it literally causes your discs to compress. So drink water consistently throughout the day. We recommend at least half your body weight in ounces. So that would mean if you weigh 100 pounds, you would drink at least 1.5 liters of water a day. We recommend at least 2.5 to 3 liters of water a day. Number 4, movement. Walking is one of the best things you can do for your spine. It's rhythmic, bilateral, and it pumps nutrients into your discs. Because discs don't have a direct blood supply, they actually absorb nutrients through movement. So aim for about 20 to 30 minutes of walking every day. These habits will compound, so small, consistent changes over weeks and months produce dramatic results. You're building a foundation for a healthy spine that will serve you for the rest of your life. If you have any questions between now and your next visit, our team is always just a call or text away. We've got your back every step of the way.